Hey, everybody, welcome to Shut Up and Listen to Her. This is our weekly podcast about our experience trying to get our health back on track and how difficult it is for us to really be able to connect with our doctors. And we're lucky today because we have a special guest. But before we get into that, I want to say hi to Tiffany Kane, my amazing co-host and mentor. Hi, Tiffany.
Hello, hello, hello. I am so excited about today and about having a guest on our podcast. Bree, you're going to love Mel, and audience, you're going to love Mel. I met Mel, we're getting close to 2 years ago, and we worked together to launch her incredible podcast. Mel is a physician. She's a surgeon, ear, nose, and throat. She's also had spoken on the TED stage very successfully, and coaches doctors and helps them with mental health and taking care of themselves. Mel, I'm going to throw it over to you so you can tell us a little bit more about you and how fantastic you are.
Oh my gosh. No pressure. No, I actually stalked Tiffany. I saw her in our TEDx community and I was like, oh my God, I have to find that girl. And I sent you, I don't know if you remember, a DM in Instagram, and I was like, I need you. Or I said something that like, you're like, that was a fun text. And then I hired you to help me start my podcast. And I would have never started my podcast without you. So like, thank you so much. Like, you were the person who got me over the hump. Yay. And out of my perfectionism paralysis, I was stuck in the how. Like, how do I do it? And like, you fixed all of that for me. So thank you for that. Yeah. And now I feel like I'm a seasoned podcaster. I've shown up every single week for my podcast, Surgeons with Purpose. And I am a surgeon by training. I'm an ENT surgeon, been in practice for 12 years. I just left my practice last year after diversifying my identity to the point that I just didn't think it was fair for me to be a partner in practice when I had all of these other things I was trying to do. I co-founded a multimedia company with a group of 7 other people. And that's 4 physicians. And I also have a coaching business. I am a master coach very shortly. And then I had one TEDx talk that I delivered last year, and that one is out. It's called How to Save Lives with 2 Minutes of Listening. It's all about listening to patients. And then I have a second TEDx talk that isn't out yet. It was selected as an editor's pick, and it is about applying the idea of black swans. I call it swan theory. It's something I derived from Christopher Voss in his book, Never Split the Difference. It's been applied to the FBI, and it's revolutionized how they negotiate with hostages. And it's been applied to all these different industries, but it's never been applied to medicine. And I think it will really revolutionize medicine if we apply it. And so that's what that talk is about. And that's
very
my
cool
story.
So everybody, you can see why Mel was perfect for this podcast, because she talks about the physician-patient connection and the importance of listening. And as we have said on this podcast many, many times, yes, we've had very frustrating interactions with doctors, but we don't hate doctors. Doctors are very important. Bree and I both believe in the medical system and seeing our doctors, and we want to be partners with our doctors. So we're really excited to have you today, Mel, because we're hoping that you can help us get some tips for, how to be partners with our doctors and how to help encourage our doctors to be partners with us. So, yay, we're glad to have you today.
Well, I have to throw something in here because this is something that I just saw and it really struck me. And so I would love, Mel, I would love your opinion on it. What do you think about it? But I watched this and it felt like it was the thing that I was missing. And do we talk about our patients as my patients or the patients? And I think there's that difference because to me, that is the anxiety, stress, the sadness within me when I feel like I'm a patient and not my patient with the doctor. I want the doctor to say, this is my patient, because it does give ownership, and it makes me feel like they are taking responsibility for my health, which is why I'm going to them. So I love your thoughts on that, because to me it just was like, that's it. That's that feeling I'm struggling with inside of myself right now.
Yeah, I have a lot of thoughts about that. And I've always been the kind of person who takes extra ownership. So I always erred on like I own them. Like, you break them, you buy them is kind of like the thought. Like, once you operate on someone, they're your patient. Like, you've married them for life. That's like a surgeon's perspective. But I also have this idea, and I got this from a colleague of mine, that maybe the term patient isn't even appropriate. Like, it kind of speaks to the whole paternalism, like, part of the system where the doctor is all knowing and the patient doesn't know anything. It's like, they're humans, whatever you want to call them, they're humans. And you're not my human. I don't own you. So there's a piece of ownership in advocating, but then there's also this piece of not being the person who has all the answers. There's this concept called helping, fixing, or serving. It's from an article written by Dr. Naomi Rachel Remen from the 90s. And she talks about how she, as a patient with Crohn's disease, and now as a physician, recognized that her job was not to help or fix, it's to serve. Because when you help, you assume that the world is helpless and they can't help themselves. When you fix, you assume that the world is broken or the patient is broken. But when you serve, you assume that they are a whole human being. And everything serves. And like, you cannot burn out. When you serve, it both fills you up and it fills up the person. And you have to recognize that patient or that human in front of you as a whole, complete human with their own lived experiences, and that they know more about their body than we actually know about their body. And they have more answers. And I think part of the physician's job as a coach to help partner with the patient to together find an answer. And actually, have you heard of Dr. Feigenbaum, David Feigenbaum? Mm-hmm. Yeah. Okay. I think he's a really good example too. I don't know if the audience knows his story. He wrote a book called Chasing My Cure, which I just finished. And he was supposed to be on my podcast, but then he had a doctor's appointment or something. I think he's getting too big. He's probably too big for me now. I emailed his team and I was like, will you come on? But he was essentially in the shoes of a patient when he was in medical school, where everyone was kind of passing the buck. And it was like, they didn't know what he had. He has something called Castleman's. It presents like lymphoma. So when he was a 20-something-year-old, they were like, oh, this is definitely lymphoma. And then they didn't know what it was. And he's at, I think, Duke, some big medical institution, and nobody was really taking ownership of him. But then he ended up at somewhere in the middle of, I think it was Kentucky or something like that, or Alabama. And he was with one of the biggest names in Castleman's disease. And he recognized that nobody knows anything about this. In fact, they don't know if it's a cancer or an autoimmune disease. It's like in between. Wow. It's like the orphan of the orphan illnesses. So nobody has any skin in the game except for this one guy in Alabama. And so we went to see this
of all places.
Yeah. No horses. And he's like, they're just threw a bunch of chemo at him, threw like 7 chemo drugs at him.
Oh my God.
After throwing all of this steroid at him, just to like an attempt to save his life, because nobody knows. And I think that's the biggest piece, is the discomfort with saying, I don't know. But because he's a physician and he was able to kind of take his disease by the reins, and he jumped into it, and he did his own investigating. He actually arrived at this drug called sirolimus, I believe. It's called rapamycin. It's from some bacteria that they found on some island. And it derives its name from that. But it has to do with blocking a pathway that he recognized. His first thing was like, I have blood blisters, and these little vascular lesions come up before I have an attack. And he had 5 attacks that almost killed him. And then when he was able to kind of make the connection that, oh, these blood blisters are like a sign, they're like foreshadowing that I'm going to have an attack. And that made him believe that, oh, vascularity has to do with it. And so then he found this drug that has been in his pharmacy this entire time. And he put himself on it. He got himself put on it, and he hasn't had a relapse in, like a decade now. But he found his own cure.
Mm-hmm. And doesn't he study that now? Isn't he studying like other uses for medications? Yeah. Yeah,
And I think
he's
that
really
happens a lot with, when when it's not something that they typically recognize, or the chance of it happening, or, um, I know my husband had knee surgery, but before he had surgery, they said, oh, until we can do the surgery, let's do a steroid injection. And it caused him to lose his voice. It was in his knee that they did the injection, but then he got really hoarse, and it's still been affecting him, where he just randomly will get hoarse like near the end of the day, or he spoke to his doctor about it, and his doctor said, no, 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 that would never happen. It's in your knee. How voice. And but then we dug in and we did the studying and we looked into it, and yes, it's a very rare occurrence, and it's not something a doctor would typically see. But yes, it did affect him that way,
interesting.
randomly. And it was, you have to, like, I think that, how do we open, because he's a doctor, he had the ability to go in and do that. How do we open eyes to saying, maybe it isn't inside this box that we've always been living within. Maybe it does reside outside of that. What to look at those things?
Yeah, I think the first thing is to recognize that you may find the answer. Like, just because he is a physician, I don't think makes him special. I don't know if that is the reason why he was able to find his answer, right? I think the thought that, like, I am helpless, or I'm a victim, or I can't find the answer, that's a very different problem to solve when you start to solving for, let me look outside myself. And because I'm not the one who has it, I have to find the person who has it for me. You're going to solve a very different set of problems than if you believe, maybe I could find the answer. Maybe I have the ability to find it. Maybe I don't need somebody who went to 4 years of medical school and so many years of residency. And they were taught guidelines that have likely shifted. And a lot of our guidelines are based on data from 7 years prior. And it's a cookbook that not everybody fits into. And humans are very complicated creatures. We treat, like, the medical system treats them as if they're a machine, and, like, a screw is loose here, so we send you to, like, the ear people, like, that's me. And you have a sinus problem, you come to me, I fix your sinuses. But then your sinus disease has an effect on everything else. Like, sinus disease, we know, has an effect on psychiatric illnesses and on other parts of the body, and inflammatory markers in the body. But nobody ever taught me in residency or in medical school to study that. I had to kind of do my own kind of investigating with my patients. And so if you don't have someone who's willing to do that, then you're not going to find a person who will have the answer for you. They're going to say, I'm in my lane. I have blinders on, and I won't look outside. And that's probably not the person to help us find. So then we have to kind of step in to be the creator.
So I have a follow-up question on this then, Mel, because I'm really there. I like to research. I like to look. I'm utilizing AI to kind of help me, like, here's all my symptoms, what are differentials, and kind of trying to, and it comes up with stuff, and I look at it and, like, I don't think that quite fits. And I'm doing this, right? And then I go to my doctors and say, all right, I've been looking, I've been blah, 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 and here's some things that have come up. Can we explore this further? In addition to that, I have taken every lab test, every scan, every medication I've been on, put it on a spreadsheet, looked at, results, kind of brought them together, and I told my doctor, like, this is the exact conversation I had with my doctor. She's my nephrologist. I said, all right, here's everything. Here's my spreadsheet with everything on it. Here's some possible, things that could happen. I do a lot of research. And she's like, oh, Dr. Google, and completely treated me like I was, like, there was in fact, she wrote in her notes that she suggested I get behavioral therapy because I have anxiety about my health. I'm like, what in this said I had anxiety? I'm being proactive and saying, could this be, can we explore this together, right? So how do we, because I'm really going into this wanting to be partners with my doctor. Like, in my head, I'm thinking, oh, a doctor would be really excited to have a patient who's absolutely motivated. I don't drink caffeine. I don't drink alcohol. I'm on a low salt diet. You tell me to do it, I'm going to do it. I'm working on losing weight right now, although I think one of my problems, what I'm having, is affecting my ability to lose weight. Anyway, with all of that, like, I'm like, you tell me to do it, I will do it. I adhere to my medication like it's a religion. Like, why don't doctors want patients like us that are like, I am motivated, I want to feel better, you tell me to do it, I will do it, and I will research on my own, and maybe we can be partners in this. It's, to me, that's one of the most frustrating things, because I think if I was a doctor, I'd be really excited about having a patient like me. I'd be like, all right, let's do it, this is cool, I got a patient that's gonna like work with me.
Yeah, no, you're so right. And I'll give you a little insight. Like, the doctors, it's nothing personal. I want everyone to recognize, like, it's nothing personal with you, Tiffany. You're lovely. I'm sure doctors love you if they knew you. And Bree, you're lovely. I'm sure they would love you if they knew you, if you have had anybody treat you poorly. What they want you to be is simple. They want you to fit into their guidelines. They want to have something that they're like, ooh, I have the answer. Mm-hmm. Because they're not serving. We haven't been taught to serve. We're serving ourselves and our ego. We're serving our desire for things to be as simple as they were when we were in training. And so, and we're given 15 minutes, the way that things are structured. So you come in with a medical mystery, and they're like, and they see the paperwork, and they see how much time that they're going to have to like sift through to understand your case. And they're like, you know, their heart drops out of their chest. So it has nothing to do with you. It has everything to do with the fact that what you're dealing with isn't a simple problem. Mm-hmm. And there's not an easy solution. And then on top of that, they have to say, I don't know. Yeah. And that's painful for them. And so I think to bridge the gap, like how do we gain trust? How do we have a conversation so it's not like you're speaking different languages, is first to recognize that doctors come in wanting to have a practical conversation. There's this great TED Talk by Charles Duhigg that talks about the 3 different types of conversations. In my experience and what I teach my clients, I think there's actually 4. And so the first is social. That's like the number one conversation humans have. 70% of the time we're having this. It's just who we are. And that's like chitty chatting, like office politics, anything about like where you're from. And then emotional conversations are, what are we feeling? And so that's a big conversation. And Charles Duhigg gives the example of a urologist who couldn't speak to his patients, who was trying to tell them, oh, we only need to observe your prostate cancer, but they weren't hearing him. They were like, no, cut it out. And he's like, but you don't need surgery. And they weren't hearing it. They weren't seeing the data. They weren't hearing the conversation because he skipped over the emotional conversation. What he needed to say was, what does a cancer diagnosis mean to you? So he was able to change himself to get through to his patients. And then the third is practical. That's what doctors want. They want to come in and they're like, what's the decision? What's the next step? How do we solve this? So they come in and they're like, what's the diagnosis? What's the treatment? That's all they want to get to. And the disconnect happens when a patient is like, no, I'm having an emotional conversation, or I'm having like a social conversations matter. Like, I need to get to know you, whatever it is. What you're trying to have, I think, Tiffany, this is the 4th conversation that I think a lot of patients come in that doctors skip over, is an experiential conversation. Mm-hmm. And what you're trying to arrive at is, I follow, and you just need a space to tell your story. And the doctor just needs to just follow along as if they're playing a movie in their head and they're the protagonist, so they understand what it's like to be in your shoes. And so it's like, the question is, how do you get from a patient's perspective, like, how do you say, like, hey, I know you want to have a practical conversation. I know you do. And I know you're strapped for time, but I really need you to have an experiential conversation with me. I want to tell you my story, and I would love for you to just get to a place of, I follow her. I just want you to understand it. Right.
Really, and then, and do you think if a patient says that to a doctor, if we said it in that way, would it get through to a doctor and be like, oh, okay?
Maybe it would be disarming. I think it would be disarming if you were like, okay, can we just talk about the elephant in the room really quick? like first thing, like, hi, nice to meet you. And you're like, there's an elephant here. It's massive. And let's talk about it. I'm complicated. I have a medical mystery. And I know that you are not wanting to walk into that right now. I know that you want something simple, and I know you want something practical, and you want to get through it in 15 minutes. We're probably not going to. And so we need to develop a relationship. I'd love for you to have an experiential conversation with me. Can you just give me space so I can tell you my story? And all I want you to do is just be in my shoes and follow along. And then, step out of doctor hat, put on human hat for just a minute, and then go back and put your doctor hat on, and we'll talk practicalities. Can you do that for me, please? Like, getting their buy-in.
Amazing. That's
right?
amazing. Yeah. Yeah. And when I think about that conversation I had with the doctor, she walked in the room and this had been like I'd been brushed off so much and just
Yes.
doctor's not listening. And so I said, "Okay, I just need you to hear me out. Here's what's been going on and here's how I need your help." And she looked at me like, "What the?"
Yeah.
So I obviously approached her in the wrong way. Like I just came out of the gate of I need you to be quiet for a minute. I need you to listen to me. And
Yes.
we need to work together, right? Because she kept interrupting me, right? And I'm like, okay, this, I need you to stop. Like, you need to hear me. So I put her on the wrong, like, we got off on the wrong foot.
Yeah. So
And I have to put a lot of that on myself because I was going into that situation frustrated and expecting to be frustrated. Does that make sense?
yes, exactly. And like it's amazing that you're taking ownership because now it's like radical responsibility where you're recognizing had I come at that from a different emotion and gotten her buy-in, like given her a little something like I
Yeah.
know that this is what you're wanting and it's not going to be like that. Let me just let you know it's not going to be what you want it to be. This isn't going to be easy. That probably would have like opened up a little door
Yeah.
that may have led to connection,
Yep.
which is what I think I want people to hear because it's like you're not disempowered. Like you can get these people on your side, but you're going to ostracize them or you're going to shut them down if we come in frustrated and like and requesting us for them to be a specific way. Because now you're saying like the way that you normally are isn't going to work for me. I need you to be different. And that just shuts people down. And doctors don't have good communication skills in the first place.
No, they don't. And it does. It depends on the doctors. And I, at least if I look at, some of the different doctors that I've seen, I seem to get on a lot better with endocrinologists than I do with physicians, right? There's they like a whole different category amongst themselves.
Yeah.
And so do we need to change who we are to work with our doctors? No, but is there this way that we can have the conversations that we need to have as patients? I'm hearing, Mel, I'm hearing what you're saying, and it makes so much sense. And I'm hearing what Tiffany is saying of how I walked in there frustrated. And I'm hearing what we're hearing in the audience, like, Tiffany, you did nothing wrong. But we have told our story so many times to our physicians. Now we have to go see another one and see another specialist and see this. And then they ask, and then when you get there, they're asking, the nurse is asking you things. They're asking you things when you check in, and then they're asking you things again when they go and weigh you, and you're just like, oh, I really didn't want to see that number. And then you go into, right, and then you're in the room, and then they're taking their blood pressure, and then maybe you're seeing a PA first, and then so there's all these different people, and they're all asking you the same questions. And so a lot of times when you get to that doctor, you're just like, I need help. Mm-hmm. And you just want to scream and cry. And you've said this story and you live with it every single day. And so you get that frustration, and it's hard to then take into account that your doctor is also a human being, and they have feelings and they have their expectations, and we need to still set that stage. But I think it is important to be able to, if you have a task, if in anything that you're doing, if you have a task that you need to accomplish, you need to start at the right starting point, which is what you're saying, Mel. You're saying we need to have a better starting point, because that will take us on the right path to what we hope is that resolution that we're looking for. And it may not be, and we need to be okay with that as well, because so far we haven't been able to find answers, right? So how is this, I think we can call it a win in our as a patient book is when they are willing to step in and say, let's figure this out together and mean it. And so I don't expect you to have, and so if we say that at the beginning, when we are going, I've told this story so many times. I am so emotional over it because I struggle every single day. And I just want your help, but I want your help in a way that says we're going to work on this together, and I don't expect you to have all the answers.
Yeah.
Yes, and I recognize that, and I see that both can be true at the same time. That yeah, you go through this system that first steals your capacity. So you're coming at low capacity. One, because you have an illness that has no answer for it. You don't have any answers for, and you're dealing with the symptoms of that. And then they ask you the same questions, and you have to talk to all these people over and over again. And nobody asks for your, nobody says like, hey, do you want to step on this scale? They just like usher you over to the scale, and off you are, and you're on the scale. And now you're processing the emotions of having to look at a number maybe you weren't ready to look at. And so there does take, I think, a lot of processing of emotions ahead of time and preparing yourself and telling yourself, like, I have the capacity. I know I've gone through this process. I know what's going to happen. I have to create the capacity for myself so that you have the capacity for that physician when they come in. And then before you say like, I need you to, I really need you to listen to me. I think it would be helpful to just start out and say like, listen, you're going to have judgments about me. Like, I know you are, because I might cry. And that just might happen. So just FYI, if you have judgments about me, that just may be the thing. That's okay. But what I want for you is I want to find a partnership with you to help me find an answer. And I know that you may not have it, but I just need to know that we're on the same side. So wherever the conversation goes, let's try to get on each other's side, please, as often as possible. I think it's so hard, right? We always end up on two different sides.
I love that, Mel. I think that's really, really, really good advice. And we need to see our doctors as humans, and they need to see us as humans, and that we're building a relationship. And I think sometimes when we have these very complex issues and we're seeing multiple specialists, cardiologists, endocrinologists, nephrologists, like we're like boom, 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 seeing all these different specialists. It feels hard to create a relationship because they're looking at that part of your body. And so doing the work to create the relationship and knowing that it will take time and having patience with it taking time, because we're both humans and all of that, I think that's really, really wise. What about the blatant bias and sexism in the system towards women? I mean, we know women were, for the longest time, there was a rule in 1977 that women of childbearing age could not be in any medical testing, clinical trials, anything. And it was only in 1993 that women started being invited back into, like, it started being a requirement that we need to do these tests on women. So there's not a ton of data on us as women. We are expected to deal with medications and illnesses and all of that as men, because it's men's bodies that have been tested on. We are expected to stay at a certain BMI, no matter what our age, no matter if we're 51 and perimenopausal and whatever. Like, if your BMI is not on it, then there is a moral failing on your part, and whatever medical issues you're having, they're all going to be solved if you lose weight. So just lose the weight. Or if we get upset about something, well, you have anxiety, and that's all of your issues are from anxiety. And I'm coming to this from, yes, weight causes issues. Absolutely. Get it. Yes. Unhealthy lifestyle, whatever. Absolutely. Anxiety, stress, it does stuff to your system. Completely understand. I've been there, done that. I know how my body deals with stress. I know how my body deals with anxiety. I know that this weight I'm having right now is out of my control. Like, I need help. And that was like my initial, when I first went to the doctor 2 years ago, was I need help. I have not changed anything and my weight has skyrocketed. I need help. Like, I'm an active person. I'm a healthy person. Blah, 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 blah. And somehow that became, she needs to lose weight, right? As if I didn't know, like I get counseled on healthy lifestyle every time I'm at the doctor. And I'm like, are you not paying attention? Like, I track everything I eat. I'm on a 1,200 calorie, low sodium, gluten-free. I don't eat out. I don't, like Whole Foods. Like, what else can I do? You need to counsel me on healthy living. Yeah. So I think take it away from me for a little bit and on every woman that is listening to this. How do we overcome that massive hurdle of the bias against women, of it being our hysteria, our weight, our fault that we are having these issues and that we're such complex bodies with our hormones and our whatever. Like, how do we overcome that with our doctors?
Yeah, I mean, there's no simple answer. I think this is a massive ship that is going to take a really long time to kind of steer in the right direction. And from a physician, like the inside place, and this is what I try to teach a lot of my clients and mentor them on, is always asking for buy-in. Like when I would ask my patients if they wanted to talk about weight, I would always ask them first, like, hey, would you want to have a conversation about weight? And sometimes they would be like, no, absolutely not. I was like, no problem. Like, we will shelf that. If you do not get buy-in, there's no reason to have that conversation. It's totally in the patient's, it's in their control. I think that has to happen. That's not going to happen tomorrow. And you can't make your doctor do that. You can't be like, hey, get my buy-in first. You can't do that. But can we find curiosity? I think we got to go first, right? As humans, as patients showing up, somebody has to go first, and somebody has to find the curiosity and the connection and get creative. And how do I find a common ground with this person? That is how we invite them to care about us. And then they're going to be more likely to listen, and you can open up a conversation. Like, listen, like, actually those lab values, they don't work for me. I mean, I know this as a patient who had postpartum hyperthyroidism. I did the same. I tracked my symptoms and my TSH, and I brought it to my endocrinologist, and she's like, what is this? Like, you're normal. And I was like, no, but my TSH likes to be between 3 and 5. And she was like, no. Like, we have to get you, we need to increase your hormones, get you lower. Cause then I was pregnant at the time. And so I had to be hyperthyroid or feel very hyperthyroid throughout my entire pregnancy because I had to do it for the baby. I was like, now that I have a baby, now that I'm a vessel for a child, now it's very important for me to be at a certain number for whatever reason. But before, they were like, you're just in the range, doesn't matter. But I tracked my symptoms, and I was like, this is where I like my TSH to be. And she didn't really hear me. And I think there has to be, there just has to be I never got curious with her. I just wrote her off. I was like, she doesn't listen, she doesn't care. But I never got curious and said, like, hey, what's going on here? Like, why are you so married to the current guidelines, or why exactly are you recommending that specifically? If you get curious and you start to try to understand where they're coming from, I think that will open up. If it's patient to doctor or doctor to patient.
And it won't feel like an attack of maybe it's the tone that you use. I don't know. Because why are you so married to those norms?
It has to come from pure curiosity. It doesn't matter what words you say. Find curiosity in your body, because you're going to want to get into defensiveness and what the hell, this it shouldn't be this way. That's not going to work as well. But if you just get really curious, be like, wow, I'm not being listened to right now. What are we missing?
Mm-hmm.
Yeah, I think we definitely need to look at what are we missing? What are we not saying, or how are we not saying it? I know that, we can, and I have wished and I have prayed and I have hoped that I would run across a doctor that would just be the doctor that I'm looking for. I traveled. I went to Mayo Clinic to see doctors. It's the Taj Mahal. It is white marble floors with a grand piano in the atrium with cafe shops, and you are transported to this otherworldly place of incredible medicine and the most amazing research and doctors in the country. And I got the same thing. And I had a female internist who was supposed to be, and so I'm getting to a question with this, but she was supposed to kind of be the overseer of all things for me, right? So I went to her, she did the intake, she did an examination, we went and talked through everything, and I told her all of my struggles, and I cried, and we did the whole thing. It was probably an hour and a half meeting. It was not 15 minutes. This was a very long, very good meeting. And then she said, okay, we're going to do this, and we're going to send you to this person, and I'm going to get all of this stuff. And then myself and my team are going to look at all the results and try to figure out what's wrong with you. And I was so encouraged. And I was like, finally, I'm getting what I need. And I had a follow-up meeting with her after all the results came back and everything's functioning great. Um, and it was as if I had someone, an alien had come and abducted her and put themselves in her place. And she just said, well, you have to understand that after a major medical surgery like open heart surgery, your body can shift and change, and you will be getting, like, you can expect to see more weight on. And I said, okay, how much weight are we talking? About, there could be a 10, 15-pound fluctuation in what your norm is, right? Your happy body weight. And I'm like, so what about the other 75 pounds on me, right? And I just was so disappointed. So how do we, when do we say this isn't the like, when do we say this isn't the doctor for me? Or like Tiffany, she saw her nephrologist. Maybe she didn't, not that it was her responsibility to, of course, make it easy for the doctor, but you want to still go into that situation where you're expressing, like, you're getting their buy-in and you're trying to say, hey, I'm just so desperate. Can you please listen? And maybe we can work together on this and be a team and a partner. And we may not have the solution right away, but like, when do you go, it's it, I'm done. I need to see somebody else. Where do you see, and we, Tiffany, I want your thoughts on this. When is your, like, enough is enough, I'm going to someone else?
Like, when do you get a second opinion? Or
when do you get a second opinion?
Third, fourth, fifth.
Third, fourth, yeah, exactly.
I mean, I don't think you can always get more opinions, right? But what I think, like, maybe that's not the right question to ask, because it still assumes that there is a person that has some secret answer, and that may not be the case. There may not be a doctor out there. And this all comes down to kind of like the drama triangle. Have you guys heard of that before?
Mm-hmm.
Yeah, of like
Will you tell, in case people that are listening don't know it,
yeah.
would you share?
I'll go through it really quick. So in the drama triangle, it's this construct that was created by Stephen Cartman in the 60s. And there are three components. There's a victim, a persecutor, and a rescuer. And if we as patients show up as victims, then we believe that only someone can hero us. So we're looking for our hero. We're looking for someone to rescue us. And we put the doctor as a rescuer. And so we enter into this relationship that nobody has consented to. Your doctor has not consented to be your hero. But when you show up and you're like, I am a victim, you must hero me, give me my answers. Mm-hmm. Now you're in this relationship that it's kind of like when you're in like a relationship with a boyfriend and you don't know, or like you're dating someone, you're like, are we seeing each other exclusively? Like, what's happening here? Like, nobody's talking about the terms of the relationship. And obviously from society, patients do this all the time, because you say, like, heroes work here outside of hospitals, and like healthcare heroes and blah, blah, blah. Everybody has put us in this hero role. And I think it's not okay. Like, I do not consent to being a hero, and no one's hero. Mm-hmm. And dually, it's a problem, because doctors want to be a hero. There was a time when my ego loves to be a hero. Mm-hmm. All right. And so I'm not trying to live for my ego, though. But a lot of doctors haven't figured that out. They're like, their ego still rules kind of their lives. And so when they have the answer, they're like, yes, I feel good. And when they don't, they're like, I feel bad. And so if they don't have an answer for you, it's that black and white, all or none type of thing. But if we step into this empowerment dynamic, it's called the empowerment dynamic, created by this guy named David Emerald. The victim becomes a creator, the hero becomes a coach, and the villain, I guess in this case it would be like the medical problem, becomes a challenger. And so now it's just showing you what you value. And there's a lot of villains here. There's a lot of persecutors. You have the system as a persecutor. You have the lack of communication as a persecutor. All of these things are challengers, and challengers always show you what you value. You're like, oh, I value having a connection with my physician. I value being listened to. All of these things you wouldn't have known if everything was perfect and you just went in and everybody listened to you and everybody had all your answers. So now you know what you value. And I always come down to this example, but it's an extreme example. I'm still like partway through Man's Search for Meaning by Viktor Frankl. I always come to the conclusion, like, if he could find meaning in the Nazi death camp, like, I can find meaning in anything. Like, that is the extreme example of somebody finding meaning, or like Nelson Mandela finding meaning in his 10 foot by 10 foot cell and then becoming the president of South Africa. These are great examples of people who could have played victim, who could have said, like, I'm a victim, I give up. But they both decided to step into that creator role. And I think you can't step into the creator role unless you find sufficiency in where you are, where you're like, okay, I'm in a hole. I don't know what the hell's going on with my body. My body seems to be boycotting and doing all this crap, and nobody knows why, and I don't know why, and I can't predict it. And I'm okay. I'm alive. I'm okay. I'm here. I have clean water. I have food. Like even if it comes to that, like there's a sun outside, like finding sufficiency in what you have, and you're like, and I have no answers, and I'm okay with that. And then that's how I think how you get to step into the creator. And then once you walk around the world as, I'm not looking for a hero, I'm looking for someone to coach me, then you can start to invite your doctor, like, I'm not looking for you to hero me. And again, like whatever you say, it doesn't matter. I think it's a state of being and who you are when you navigate these appointments.
That's really paradigm shifting.
Yes.
I really appreciate this. I wish we could talk to you for like hours and hours and hours and really like dig into that, because I feel like that would make such a difference for so many of us to take ourselves out of the victim role. I mean, that's how people get stuck in toxic relationships and toxic marriages, is there's always somebody that's a victim, there's always somebody that's the persecutor, then there's always somebody that's a hero, and you're just in this vicious cycle and everybody switches roles. And I think that happens in one doctor's appointment, right? Like your doctor goes from the hero to the persecutor, and you know what I mean? And to the doctor, you're the persecutor because you're driving them crazy and they didn't sign up for this today. And so then we do get stuck in this vicious cycle. I'm really glad you brought that up. It's a totally different perspective on this. Like it's a beautiful kind of subtle shift, but a really nice one of going into our appointments, not looking for a hero, not necessarily looking for solutions, being in that curious place. I'm really appreciating this, Mel. Thank you.
I love that you're like, I see your wheels turning and you're like having a moment. And I love that.
Yeah. I really, 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 yes, I appreciate that. This conversation, I knew would be good today. I knew it would be good. It's even better than I thought. So thank you, Mel.
Good. And you know, and I want to say that like, it doesn't mean that there aren't things that need to fix. Like, again, it's like the both and thing. It's like, I am not playing a victim, and I see clearly that this system is not working.
Yeah.
It's like not, but it's not consenting to the relationship. You're like not giving it your power anymore. You're not giving your doctors your power anymore. It's only entering into relationships you consent to.
Oh, I love that. Yeah.
It's something that we totally need. Go ahead, Tiffany. But I
was
wanted
just
to
going to say,
say
it could even be as simple as not sitting on that damn exam table to have the conversation with your doctor, because that kind of automatically you're sitting on that crunchy paper and you're uncomfortable, and you know, doctor is sitting in front of the computer, and automatically that creates a relationship dynamic where you're like the little child on, you know, sitting on the exam table. And so maybe it's, you know, even just asking your doctor, hey, while we're having the conversation, can I just sit in this chair so that I can, you know, we can talk more face to face, and I can feel less like the patient and more like a collaborator in this. You know, it could even be something like that, I'm guessing.
Yeah.
I think that does work. I actually experienced that at Mayo when I was down there. I went in, the first room I went into was just an office room almost, where it wasn't a full out office, but it had a desk, and we were seated across from each other so we could look at each other as we spoke. And then for the exam, it was actually in the next room. So then I was taken in there, and then we went back in and discussed back face to face again. And I did like that dynamic. I think it felt a lot different. It gave me a lot of false hope, but unfortunately, I liked that. And so I think that's an important point, Tiffany, to make that, you know, it is something. We're not perfect. We're not perfect. The doctors aren't perfect. We don't have to make excuses for them, but we also need to go into any situation. If in anything that I'm going to do, if I walked up and I was, you know, I stopped at Target, there anymore. But if I stopped at Target and I was going to go to the customer service desk and I just, oh my God, I came in just loud and like, I need your help. And I'm like just out of control. And because it's so impactful to me. And then I didn't get the response that I wanted from the person that I was talking to. And it's their job. They're the customers. So they're supposed to listen to the customers. I want to make sure that when I'm speaking to somebody that I'm not coming in and already putting up barriers in between us, but I also want to be powerful and be strong and say, I'm in a really bad situation. I can't put my shoes on and tie my shoes easily. Socks are a problem. I can't go and walk down the street and take my dog for a walk because it's too hard on me and it causes me pain because I'm not getting better. Right? This is like I can't do everyday things anymore. So it is in my mind, life threatening, right? So I want them to feel the urgency of my issue without screaming it in their face.
Mm-hmm. Yes.
That's the part I need to get to.
Yes. And I think, hopefully, again, like I wish I could just train all the medical students so that they could learn these things. But again, if your doctor is trying to arrive at an experiential place where you're like, I just have to get to I follow. Like my role here, I'm meeting this person for the first time. And I do this with every patient I meet. If I'm seeing someone as a new patient, my goal is merely to sit in their shoes and understand what their lived experience is. If that was a singular goal that every medical student were taught, it would be very different than when we go see doctors for the first time.
Yeah.
Like we have a different understanding. You literally have to jump out of doctor role, go into human, just because I become Bree now. Like, so I can understand. And that's how I get the gravity. She doesn't have to yell it. She doesn't have to scream it. I'm living her experience. I'm imagining, what is it like to not be able to walk my dog? That would suck. Mm-hmm. And so now I understand what it's like. Now I have this skilled empathy. I think that's really important so that patients don't have to be like shaking their doctor and like, this is my quality of life and it sucks. It's in the shitter. Like, how can I swear?
Yes,
of course.
Absolutely.
Are you kidding? Do you know? She's a clever biatch, like that's her handle.
I love it.
I had a Dr. Mel. This was my first nephrologist at Kaiser. I said to him, I'm having a hard time because this is definitely affecting my quality of life. Mm-hmm. And I'm usually an active person and I do all these things with my kids and I don't have a quality of life right now. In fact, we did Mother's Day in bed and we did a Star Wars marathon because I couldn't even get out of bed for Mother's Day. And that's not me. Like, we've always had adventures for Mother's Day. I'm like, I just don't have a quality of life anymore. It's affecting all of my relationships. I can't be with friends. I can't. And I need help getting my quality of life back. And do you know what he said to me, Mel? Okay. If you watch my skits, he said, I know nothing about your quality of life. How can I do anything about your quality of life? How do I know if I fix this that you'll even have a quality of life?
That's so fascinating.
I was like, are you effing kidding me right now? Like, what the hell?
I wonder what he was thinking.
I don't know. I have so much fodder for my skits from this one doctor, this one 15, 20-minute interaction with him. Like, he hit the whole book of I am God and you are a peon.
Yes.
Type of attitude where I was just like, what just happened? What just happened? Yeah.
Yeah. He can probably calculate glomerular, I don't even know the renal terms anymore. Like they've all fallen out of my brain from medical school, but I bet he can do the maths on that. And that makes him feel very big and very important. And he's very intelligent, I'm sure. But again, what does that matter if you can't translate that intelligence? You have your job, your singular job. You have a patient sitting in front of you. You're there to serve them. It comes back to serving them. What does it matter if you have all that knowledge in your big brain if you're not, articulating it in a way that is received by the human you're there to serve? Makes no sense.
Mel, I wish you could just change the world. I always say, man, if we were in charge.
Seriously. Yeah, we just need to well, I mean, this administration would never put us in charge. So that's a whole other conversation.
This is very true too.
On that.
But I think, it's one doctor at a time and we just have to keep hoping that we'll find that right thing and do the right thing and get our point across, whether we're screaming it at the top of our lungs or we're caring about our doctor's feelings, which are human, may not agree. We're not being mean. Are we being mean? Are we being loud? However we get our point across, as long as we keep trying and keep showing up and keep doing whatever we can and supporting one another on this journey to health, which is really what is the most important thing. And not give up on ourselves. I think that's when we're really in trouble. Mm-hmm. And we can start making a difference. And maybe we will have that one doctor that makes, where we make that connection with them and we make it okay. And I'm not saying that it's our job to make the doctors okay, but we do make that connection with them and they maybe change their perspective a bit, and their patients going forward and you as the patient can start to grow together, because we're not perfect beings. We're all trying. We all have our own issues. We don't know what their morning was like. They don't know what our morning was like. So we do need to come in with that mutual respect and try to find a way to be heard, because if we're talking quietly or we're crying or we're screaming in their face, the most important thing is we just want to be heard and understood. And so finding the way to do that moves us forward and hopefully finds the solutions that we're looking for. But Tiffany, I would bet almost that you have a real water issue as well, because if you're not eating that much and you're still putting weight on, it's a water retention issue. My cells are like saturated. They're in what do they call it? They are in like a panic mode, so they're withholding water. I've lived in this panicked kind of stressed out mode, and it's not stress. Like, I'm not causing myself stress, but my body thinks that it's in fight or flight at all times, and it will not. I need to get homeostasis. I need to get to that space where my body says, okay, we don't need this water anymore. Because right now it thinks I need it desperately and it's holding on to everything it can get. I've had 820 milligrams of sodium today. I've had 2 meals. I am on track for a 12 to 1500 milligram day of sodium. I will still probably gain half a pound to a pound of water today. And that is just the truth of it. So I have to figure out what to do.
That's so frustrating.
And I lost my camera. There you go.
Mel, before we wrap this up, I know we're going a little long, but this is just such a good conversation. Before we wrap this up, do you think it is useful, helpful to let a doctor know when they have really kind of damaged us? Like when it's been a very obvious, blatant situation where you were not even interested in listening to me, you were demeaning, is it helpful in a respectful way to let that doctor know, whether it's at that appointment or afterwards, maybe writing an email or a letter or something? Do you think it would be impactful? Would a doctor hear that and go, oh, okay, I didn't never intended? Because I know I have had situations with people where they're like, hey, that really didn't feel good. And I'm like, oh, no, I didn't mean to. That was not my intention. And let me change the way I'm dealing with the situation. So I know personally, I appreciate when somebody says, hey, this is how it came off. Are doctors open to that? Or would it just go over their head? Would they, oh, there's that emotional woman again? Like, would it even be effective? Is it worth our time? I don't know.
Yeah, I mean, I think it's absolutely worth their time, especially coming from like a disappointed, almost like a disappointment place, right? Where this interaction did not give me what I needed. And here's why. Just to tell them so that they can learn, instead of like going to like a board and write, or going to Google. I think that's what we try to do, is cancel them. You can cancel them online if you want, but I think it's the brave thing. It's the courageous thing to just have the conversation with the person write them a letter, send them an email, and be like, hey, just so you know, this did not sit well with me, and here's why. And when you have other patients, it may not sit well with them. So that's something you may want to look at, work on. And I could go to the board, or I could go to Google, but I'm choosing not to, because I want you to make this change. And I think it's going to be more effective if I talk to you directly instead of like blasting it for all to see, because I'm angry. But I was angry. I was very mad. I was very unhappy. I processed through the anger, and I'm very disappointed in how our interaction went. I think that would be so helpful.
Okay, that's good.
Just like a hockey parents and hockey coaches will tell you, give it a 24-hour rule and don't do it right when you get home because you're really, really, really pissed. Let it sit for 24 hours, then compose yourself and write something that actually gets heard and understood. Because I know our immediate reaction is we're just devastated, and I can be pretty vile with my tongue when I'm in that situation. And I don't want it to just be, oh, what are they're just pissed, right? I want them actually to hear my words and make it sound good. Hey, if you didn't notice this, we have a QR code up in the top left, one of the corners. If you want to get and learn more about Mel and all she does and her podcast, please go to that QR code. The link will also be below in the description of this video. I can't thank you. And Mel, I've loved getting to know you and chatting with you. We've had a very, very busy chat. I haven't been able to keep up with all of it because I've been listening and getting really just loving this conversation. And Tiffany, thank you as always. So there's so much we could do more on this, but I want to give everybody a last chance to, give us that last word. So Tiffany, I'll go to you, and then you can throw it to Mel, and we will thank our audience. And
Mel, I want to thank you for showing up so wholeheartedly and so openly and being willing to have this conversation. It is so refreshing to be able to have the medical perspective and to be able to have I think dialogue, debate, understanding each other. I just think we live in a time where people aren't willing to do that. And I appreciate when people are willing, and I want to thank you. I've adored you for a long time, and I now just adore you even more. I just have such high esteem for you, and I thank you for all the work you're doing to improve the medical experience for both physicians and patients. So thank you.
Well, thank you. It's such an honor to be here. And again, Tiffany, I adore you as well from afar. And you have been integral in starting me on this journey of knowing that I have a voice, and that the message I have to share is really impactful and it matters. And I think I would just leave everybody with the visual that I learned from my coach, Martha Beck. She does this little experiment with sugar cubes, and it's like a pyramid. I don't know if maybe some people have seen it, and it dissolves in a pool of water. And so it's even though there are a small number of people at the very top that have all of the power and can wield all of the power, we're all at the bottom. And if we're all together and we're connecting and we're one, if we're in that pool, we can dissolve that entire pyramid. So I think we do have to just come together, and it just takes one physician at a time. I'm working within the system from the physician end. Patients have to work on the patient end, and we have to actually talk to one another and communicate in a way that we connect, and we'll get there.
Thank you. Yeah.
Thanks so much. Thanks to the audience for being so busy and participating. We will see you guys next week. Thanks so much. Bye, everybody.